to have you here this morning with us, and we're very fortunate to have some fantastic panelists here with us this morning to talk about COVID-19. Before we get started, I do want to just welcome everyone. Thank you for being here, and say a quick word from the Chamber about our members and our partners who support us every day, and for that we are extremely grateful. We have a set of members who invest in the Chamber as innovation partners. They invest in the mission and our strategic initiatives at the Chamber, and we are very grateful for their investments, particularly in 2020, which I think for each of us on this call has been particularly challenging. So thanks to those partners. We also have a group of media partners that do a fantastic job of helping to share the stories of our members and the positive narratives that are happening in our region. So thanks very much to our media partners as well. And finally, I wanted to say a quick note about our upcoming last event of the year, which is our Workforce Summit. Next Thursday morning, I hope you'll register on our website, dpchamber.org. We will have a fantastic panel talking about two signature programs from the Virginia Economic Development Partnership, one of which actually was piloted here with Morgan Olson here in Danville, Pittsylvania County. We'll also hear from Dr. Julie Brown and Dana Wilson with some regional workforce updates going on through the Institute for Advanced Learning and Research. And so with that, I want to welcome our guests this morning, Dr. Scott Spillmann from the Virginia Department of Health, Alan Larson from Sovah Health, and Ken Larking, of course, our city manager. And so Dr. Spillmann, I want to start with you. If I could just turn it over and ask you, where are we now? You know, we read a lot, but we'd love to hear directly from you where we are as a community in this pandemic.
Thank you. And I will tell you that I had every intention of speaking later. Because I know that Mr. Larson has some great information as well. Basically in Virginia right now, I'll just talk to you about Virginia quickly. Well, for the US deaths, we hit a milestone of over 3,000 deaths. And then in the last 24 hours, it was over 3,100 deaths in this country due to this pandemic. In the state, we have almost 270,000 cases and almost 16,000 hospitalizations and over 4,200, almost 4,300 deaths currently. Our more local statistics are that in the Pittsylvania Danville Health District, which is where most of us live and work, we have approximately almost 4,000 cases, about half of which are in Pittsylvania County. There are roughly 270 people hospitalized, have been hospitalized so far, with 82 deaths, 54 of those in Danville alone. There have been in total almost 43,000 PCR tests, and all tests total, including the rapid antigen and others, have been almost 60,000. Our 7-day positivity is 13.7% as of this morning, and that's just the PCR only, and all total is 12.4%. Just quickly in Southside, for those that relate to Southside, almost 2,500 cases, 68 deaths, roughly half in Mecklenburg County alone. 7-day positivity is 7.4%. And all in 6.1% all tests. It's a little bit better in Southside than it was initially, but we're still in a surge, particularly Pittsylvania Danville, among about 21 other counties. There are just quickly there are about outbreaks, which has a specific definition. Usually these are in some sort of a congregate setting. Almost 1,700 in Virginia alone, 25 in Pitt-Dan, and 17 in Southside. The Pitt-Dan, and there have been some new ones. Basically, didn't make the case right then. That's where we are at the moment. There are other things to talk about, but I'll stop there unless other questions arise.
Thank you, Dr. Spillmann. And we are going to use our chat function this morning for questions from our attendees. So please feel free to post your questions in the chat. And after we've heard from each of our panelists, and I failed to mention our County Administrator, David Smitherman. Good morning, David. After we hear from each of our panelists this morning, we'll have plenty of time for questions as well. So with that, Alan, can you offer us an update from Sovah Health?
Thank you. And Alexis, thank you especially to the Chamber. I received a notification from Dr. Desai last week, who's also joining us, and I will make sure he gets some time soon too. I'm concerned about what's happening in our community, and so Kelly Fitzgerald has been great in helping us get the word out to the press and the newspaper, but we wanted to use you as leaders in our community as Chamber members so you can be aware, number one, ask questions, and help with our efforts to see if we can stop this spike that Dr. Spillmann just mentioned. So there's three things that I want to talk about. First of all, specifically to our community, we currently have 29 patients in the hospital with COVID. That's the highest number we've had ever. That represents a 142% increase from this time last month. I have 31 employees who are out of work as a result of COVID or COVID exposure. That's an 82% increase from last month. Dr. Spillmann already talked about the test positivity rate. So we are facing a significant increase in our community of COVID exposure. Despite all of our great efforts, I recently walked through a large retail store and found about 75% of people were wearing masks, which is encouraging from where it was to start, but we're still not there completely. And I really would like Dr. Desai to talk about what we can do. The second thing I would like to talk about is please don't forget the frontline workers. We were so grateful at the beginning of this crisis, and people were doing amazing things with sidewalk chalk and food and parking lot rallies and social media shout outs. Our staff guys here at the hospital are working their fingers to the bone. They are still in the trenches. Our nurses, our respiratory therapists, the food service, housekeeping, it's the entire team. And that's not just our folks. We recognized earlier this year all of the frontline workers, the fire and the police and the folks in home health and in the clinics. And so I would say those of us who are fortunate not to be directly involved in patient care, please give recognition to those who are. Food is difficult these days for distribution, but we'll always take a plate of cookies. We're grateful for any social media that you can share out and give encouragements, and even prayers and recognition to higher beings are really appreciated. I think the way out of this, and I'll turn the time over to Dr. Desai to talk about this, we are going to be fortunate to receive the vaccine. Sovah Health will be receiving a distribution of vaccine within the next couple of days. And so I think moving forward, that will be our light at the end of the tunnel, or our hope that things can get better while we continue to focus on the basics of wearing our mask and washing our hands and limiting exposure. But we call on you as business leaders to support the mandate by the governor, limit the number of gatherings to 25. Even in churches have a allowance to gather, but I think in our churches and in our businesses, I see most of the businesses in our community are requiring masks to enter. Continue to support that. The city has been very generous in making masks available, and the county as well. There are funds available for accessing masks if you don't have them. So please, as businesses, make masks available to those who are coming to use your establishment if you are a place that is still open and available for guests. So that's what I wanted to ensure. I'd love to have Dr. Desai share a few things about the vaccine and why you should feel comfortable getting a vaccine when it's your time. Maybe a little bit about the timing of that, Balaji. And then what can we do in the meantime? And just by introduction, again, one more thing, Dr. Desai is our infectious disease specialist. He was on the call earlier. We are so grateful to have him in our community during this crisis. So he has the most information about this virus and where it's going and why it's very unique and novel. So Dr. Desai.
Thanks, everybody. Thanks for letting me join in today. I mean, as you all know, it's pretty grim as far as this COVID-19 goes. And we have a lot to do here, and I feel we can do much more than what we are doing. We are trying our best, but we need to do much more, especially in terms of wearing masks, maintaining social distance. And we all know, and we see this on a day-to-day life, that people are, I mean, as though majority of people are trying to do this and trying to be as sincere as possible, yet it's those few who are not doing it who are allowing the propagation of the infection. I mean, it's a communicable disease. I mean, it's a communicable disease. It's a preventable infection, but we are still letting it rule the roast. And that's the sad part here. To my patients personally, I've asked them, when I meet them on a day-to-day basis, I tell my patients, don't go to churches. I mean, I know it's a harsh statement to make, but I do make it. I mean, I feel bad to say this, but churches and places of worship have been places where the infection has had a free run. I mean, the spread is more easier. Going to restaurants, dining in, I mean, makes it much worse. I've lost a patient that I know whose exposure was only dining in. Amazing guy, just in his 60s. Healthy otherwise, went to a restaurant, had food, and ended up dying in 3 weeks. That was his only exposure. He had worn his mask everywhere else. So it's dangerous. I mean, there are multiple places where you can get this infection. And you got to let your guard down only once, and you get it. And the point, right, that we need to do now is we got to spread this message very strongly, much more strongly than what we did months back. I kind of get the feeling whenever I'm out there that we are losing that impetus that we had when we started with. I mean, stores need to bring back a little bit more regulations where they can put in their protocols, which they had earlier, allowing so many people to enter, going in one direction, washing their hands when they go in, cleaning the carts. We don't see this happen in all these stores. Some of them do, but many of them don't. And even a single store not doing it and 100 people gathering there in a day, I mean, that's a high risk for infection. So everything that has to be done and that can be done, we have to do it. The ICUs are running full. I've spoken to so many of our critical care physicians who are doing an amazing job. I mean, I can't believe what they're doing. I mean, they are doing an amazing job, but they are tiring. I mean, they are tired. They're really, really tired. The residents are tired. I mean, these are young doctors. They're doing whatever they can, but there's only so much. So, I mean, the residents are tiring, the nurses and the staff, the ancillary staff, you can see that in their eyes. I mean, it's 9 months nonstop work, and you can see the tiredness in their eyes. So anything that we can do, peripherally, I mean, this is a communicable disease. It's 9 months into the infection. We do not have a treatment. If you're infected and if you're not lucky, we do not have a treatment. The only way we can get the numbers better is by preventing. And the only way we can prevent it is not in the hospital, but it is in the community. So whatever the community comes up with is the best way of combating this infection. So it's in our hands. It's not in the hands of physicians. It's not in the hands of ID docs. It's in people's hand. I mean, people have to work on this. It's not going to happen otherwise. But again, the best news is the vaccine. Nobody expected the vaccine to be 95% or anywhere close to even 90%. We thought 70% we will be so lucky. We literally hit the bumper when we literally hit the lottery when we got a vaccine that can give a 95% effect. It's amazing. It's amazing. I mean, this is a dream for any infectious disease doctor, but anybody who's treating anybody with infections, getting a vaccine that can be as effective as the ones that we have now. But the most important thing is getting the right information out there. It's been extensively studied. I mean, yes, the only problem here is we don't have a long-term data, but the short-term data for this vaccine is better than what we have had with any other vaccine. And the number of people enrolled in the study is humongous. We are talking about 33,000 people in phase 3 of just the Pfizer vaccine. So that's a humongous number, and the number of side effects associated with this have been rated, ranked, and we have enough data to provide to people. But the problem is, as a physician seeing patients on a day-to-day basis in the clinic, I see patients coming up with questions. Are they putting a tracking device in me? What happens to my fertility after I take this vaccine? Is the government trying to trace me for years by putting this vaccine in? And so there are these absurd kind of questions, secondary to a lot of false media. So yes, there is a lot of bad news about it. But again, we as knowledgeable people can try to spread the right things around. This is an effective vaccine. Yes, you're going to have some body ache, fevers, mild, chills, site injection pain as soon as you get the shot, and that is going to be there, and that is a good sign because you're basically reacting to the vaccine and you're producing antibodies, and that's going to be there after your first shot, and it can be a little bit more after the second shot, but it's going to last for 24 hours, not more than that. But that is much better than getting intubated and having a tube down your mouth and being on a ventilator for 2 weeks, 3 weeks, and passing away. So, I mean, that's the kind of message we have to let people know. I mean, I'm sorry for taking so much of your time, but if whatever help we can get from whoever we can get is going to be really helpful. It's hard. It's very, very hard. I work with these physicians who take care of these patients directly on a day-to-day basis, the emergency medical staff, the ICU staff, the hospitalists on the floor. It's tough to see them. I mean, they're doing a great job well beyond what they have to, but whatever we can do to help them to control this infection on the periphery will be really helpful to the hospital staff. Again, thanks for giving me this time. And if you have any questions about the vaccine, I'll be more than happy to help you with it. Thanks.
Dr. Desai, this is invaluable. I can't thank you enough for joining us this morning. I think you've made so many good points. We probably all need to watch that section of the recording a couple of times to let everything you said sink in, not only from a public health perspective, but I think for our members on the call, and all of us are concerned about the recovery in our business community, keeping all of our businesses, particularly our small businesses, open, because we know that's where the real danger lies in the country right now. It sounds to me like you've connected some dots here in saying that if we practice these behaviors and follow the guidelines, we can stay open, not only in the short term, but we can keep our business community growing and recovering and thriving once again. So I really appreciate you connecting those dots for us. I feel sure we'll have some questions for you when we get to that part of the program. So again, thank you so much. With that, I want to let Ken and David talk a little bit about some of the opportunities that are available. Certainly, if they have any updates on what's happening specifically in the localities, they're certainly welcome to offer those. But opportunities for businesses through our local governments, whether it's rent and utility assistance or marketing micro grants, our localities have been exceptional in providing opportunities to businesses. So Ken, do you want to start us off and talk a little bit about what's available through the city?
Sure, and I want to also reiterate, thank you so much for the previous speakers. I think one of the big takeaways I get from what was just said is that the hospital system is stressed. The people there are working very hard, and there is a limited capacity. I mean, there are only so many nurses, there are only so many doctors, and the least we can do as a community is to practice the social distancing, wearing the mask, and being careful, just to help them out, to give them a break a little bit, because the surge is happening. It's because it's colder. And if I can just, as one person who is not an expert, but just listening to the experts talk, I just want to implore people to tell the community, that your friends, your neighbors, everybody, do it for the nurses, do it for the doctors. If you can't do it for yourselves, or you don't care about other people, or whatever it is, whatever conspiracy theory you're listening to about this, it's real. It's happening. We can hear it from our experts. So please do what you can. But with that, let me jump in with what the city is doing. And some of this is in partnership with the county. Some of it is only available in the city. Some of it's available throughout our region. But I will say that I am pretty proud of how proactive the city has been, our council has been, our economic development team, partnering with the chamber, partnering with DRF, partnering with others in our response. We were pretty proactive early on with implementing things, even before any federal help came along. We were implementing grant programs for businesses. We were helping with residents and their utility bills. We were helping businesses with their tax payments, especially those hardest hit by the pandemic. And we continue those things as we have progressed through this pandemic. Right now, if you're a business owner, you can go to our website. It's www.discoverdanville.com/COVID-19-resources. And you will see a list of available grant programs to help your businesses to weather the storm of trying to be safe for the public, trying to be open, knowing that fewer people are able to come out. We're hoping that we can help, but we have things like personal protective equipment and services grants. That's up to $2,500 available for helping to pay for those things. Outdoor seating grant and curbside pickup and takeout grants for restaurants. We've done some marketing and e-commerce grants to help promote your businesses. The Danville CDBG rent program and mortgage loan program at 0% interest. These are all available to city businesses. In addition to that, on a more regional basis, there's the Bridge to Recovery program that's available through the Southern Virginia Regional Alliance. So that's available to Pittsylvania County residents. Just some statistics, since the beginning, our economic development team has helped 198 businesses with a variety of grant programs that I've just listed. We have dispersed about $485,000 of funds so far, because some of it was city funding. Initially, we reimbursed ourselves with CARES Act money, but that CARES Act money ends on December 30th. So we do still have funds available for businesses to apply. You got to get your application in really soon, because the federal government, unless they change their mind, has said this money runs out December 30th. We're hoping that legislation will extend that. You know, if you're paying attention to what's going on in Washington, you're not seeing a whole lot of movement there. So, but hopefully cooler heads will prevail. We'll get some extensions, maybe get some more money. But, you know, like I said before, the city was proactive. We set aside some money for grants before we even got federal money. We still have that because we supplanted it with the CARES Act money. So we intend to continue to do some of these grants going into the new year for as much as we can, for as much as we can afford it. I'm going to just reiterate real quick, you know, our focus as a city government has been to support our residents. We've offered utility assistance, rental assistance, mortgage assistance, all sorts of programs to help individuals and residents. We wanted to support our businesses. I just talked about all the grant programs we have available. Of course, as a city government, city manager, I'm concerned about our employees. We have frontline workers as well. We have emergency providers as well. The firefighters show up at every 911 call to help begin the process of treating patients. We have officers who respond to people. We have other frontline workers who have to, you know, make sure the government's running, that infrastructure is going forward as it needs to. So it's been extremely important to me as a city government to make sure that the health of our employees is looked after. And so we've been careful with that as well, so that we can continue to provide what's needed. Looking forward, I would say that I'm, you know, constantly in contact with Dr. Spillmann and others about, well, how do we, you know, support their effort when the vaccine is available. We're happy to do whatever we can. We have 1,000 employees here at the city, and they unfortunately for them, at the end of every job description, there's all other duties as assigned. So we're going to be able to deploy some help when needed to make sure that we can sufficiently as possible deploy the resources necessary to get as many people vaccinated when it's their turn to get vaccinated. I'm not an expert. I've been reading stuff. I've listened about what this vaccine is all about, and I'm not going to try to teach you anything about it. But just for your information, when it's my turn to get a vaccine, and not before my turn, but when it's my turn, I am going to be showing my arm to a doctor as quickly as possible, because I want that vaccine as soon as possible, and I hope other people do as well. Interestingly enough, we have done a survey. I've shared this information with Dr. Spillmann with all of our workforce. We have 1,000 employees. As of yesterday, about half completed a survey with a simple question. When the vaccine comes out, will you take it? Yes, no, or maybe. No was about 30%. The rest were yes or maybe. And so I feel like the yeses, which was about 35%, I think the maybes can be convinced once the yeses get in line to also do it. So hopefully we'll get up in the high 60s, and then maybe when the no's see the yeses and the maybes getting through it just fine with a few chills and a few little issues there, then the no's will step in line and follow through. But that's just information that I thought was interesting and maybe helpful to the doctors on the call here.
Ken, that is. Thank you so much, not only for that information, but for everything that the city's deploying to make sure that we can get through this as unscathed as possible, not only our citizens, but our businesses as well. David, can you offer some thoughts from Pittsylvania County? Very different, landscape in the county than in the city, some different opportunities. Can you offer some thoughts from your perspective? David, are you unmuted? I'm looking for you on my screen.
It looks like he's frozen.
Okay. Oh, there he is. I see him.
Can you hear me?
Yes, thank
Now we
you.
can.
Fantastic.
Great.
Good morning.
Good morning. Thanks to Ken for being thorough about the programs that are available across the city limit line into the county. We have just a couple more to add to that list. But before I talk about those two, I will say that I'm joining you today from the loft of my home in Pinhook because I am in quarantine. We have been greatly affected by the virus among our staff. We are struggling with collecting solid waste today. We only have one of our permanent drivers at work today out of 7. Our treasurer's office and our commissioner of the revenue's office was closed just a few days ago due to exposure and positive cases. My building at county administration, both the county administrator's department and the finance department have been greatly affected by positive cases and learned of more today. So this is real. The reason I don't think I feel bad is because we have really doubled down our effort in wearing masks, and the mask does work. And I support what Ken said. If people would just realize the reason we are wearing these masks is to slow the impact on our healthcare system. We can't afford as a society for us all to be sick at the same time. And we certainly need to support the people that are caring for us. And we are going to continue to enforce proactively the mask wearing in our operations. It is a different environment out here. We are very rural. And sometimes we take for granted that we don't have the population density or run into people as often as we would as if we were in the city. So it's important that we realize it's just one contact can lead to an unexpected spread of the virus. So we are certainly supporting mask wearing at county government. We do have a couple programs that have been well utilized for rent and utility payment assistance through our Department of Social Services. It has been overwhelmingly positive, the number of people that we have been able to help with utility and rent assistance. And the Social Services Department has that program. We also have a new program that we have literally just today signed the documents on and will be approving formally on Tuesday, which is a $330,000 small business assistance grant program. We are providing grants of up to $15,000 per business for various items, including rent assistance, including PPE, any physical modifications to
David, we've lost you. David, can you turn your video maybe on and off?
It's that need for broadband expansion in the county. There's
That's
a
right. We
testimony
couldn't have illustrated that better. David, there you are.
For what it's worth, all of you are frozen, but I was moving just fine. I'm not sure where I lost you, but we will be having some press around this new program coming out, maybe even today, to get people in line for that. But because I apparently have a shaky internet connection, I will stop there and just reiterate that the programs Ken mentioned are still available, as well as the rent utility assistance through DSS and our small business support package that'll be formally approved Tuesday. Thank you.
David,
That's
we all
great. David,
assume
thank
that
you so much.
you froze on purpose for your promotion of broadband expansion into the county.
That's correct.
It's very effective.
Alexis, may I
thank
add?
you.
I'm
Yes.
sorry, I apologize. May I add, if you know, one thing that this group can do and maybe help with your talking to your neighbors and friends is to encourage our elected officials at the federal level to continue to support our efforts to help our small businesses, help our community get through this pandemic, through the time where all the folks that can get the vaccine, because this deadline of December 30th, you know, maybe people thought we were going to be over this by December 30th, but it's really a barrier to us continuing to help our community. And I think interacting with our federal elected officials will help us with that. Thank you.
No, I think that's great. And David, thank you again for that. I think we're extremely fortunate in our region to have all of these opportunities in place in both of our localities, and frankly, to have Ken and David's leadership. So thanks to you both. Question for Dr. Desai and perhaps Dr. Spillmann as well. Does the medical community know the difference, sorry, just one over me, in immunity? Does the medical community know the difference in immunity gained from the vaccine versus having had COVID-19?
Yeah, to a good extent, we see that the immunity or the antibodies produced after an infection, even if it is a severe infection, the quantity or the titer, what we call the titer of antibodies, is not that high enough. But the vaccination seems to produce a much higher titer and a good response to the vaccination. So the antibody produced, and from the looks of it, the duration for which the immunity lasts, both seems to be much higher with vaccination as against to having the infection. Anywhere from the immunity from the infection, we are not able to state as to how long it lasts to prevent a future infection. But from the studies done for the vaccination, there seems to be solid data suggesting that there is a very, very good level of protection from the infection. Definitely a difference. Definitely, there is a difference between just being infected and being vaccinated. And anybody who has previously been infected is also recommended to get the vaccination. There's no contraindication for previously infected people to get the vaccine. They are recommended to get it.
Do you have any idea, Dr. Desai, as a follow-up, kind of where they'll fall in the order of people who will get the vaccine?
In terms of those who have been infected in the past?
Those who have been infected, would that impact where they fall in terms of when they would get it?
It depends on multiple other criteria. I mean, once the high-risk workers are injected, I think it'll go to the nursing care facilities, people with medical comorbidities, older individuals. I think it's going to go in that criteria. Not being infected in the past doesn't, no, definitely not.
Okay. Question for any of our panelists. We know the governor will be speaking at 2 o'clock today with some updates. I've heard certainly that there would be some information about the vaccine and the plan in Virginia. I know there's lots of other speculation. Do any of our panelists have any insight on what the governor may announce later this afternoon?
I think if we had insight into what the governor was doing, our jobs would be easier, right? Ken, David, can I get an amen? I think that it's unlikely we'll go backward. Well, I don't know. Here's some good news that I think we can with confidence say. We have more access to protective equipment than we did at the beginning. When we first started this and the governor put a lot of restrictions in on elective surgery, for example, shutting down different services, closing businesses. Much of that was because we didn't have protective equipment, we didn't have masks. And I think we have an ample supply of masks in our community and access. So I think that will be optimistic. But I do think that probably, like has been said today, like Ken, he probably will say, I'm going to step up to get my vaccination as soon as I can. I will as well. I'm not on the front lines. I'm not in the first high priority group. I don't take care of COVID patients. But as soon as it's available, I will also bear my arm and get my shot. So he'll probably talk about those things and want to talk about vaccination.
Thanks, Alan. Does anyone else want to offer before we go on? Excuse me, to the next question.
I would just repeat, I guess, a little bit of what Alan said, but likely there'll be more restrictions announced is what I've been hearing. And does it go back to the way it was at the beginning? Probably not, but somewhere in between, but probably fewer numbers and businesses, et cetera, et cetera.
Mm-hmm. Ken and David, the next question is for either or both of you. Do you have any insight into the Virginia Employment Commission and their backlog on getting unemployment insurance checks out? There are a lot of calls, a lot of frustrated people, and we know that we're hearing about the county being short-staffed because of COVID, the hospital being short-staffed. We know there are those issues, but are you all hearing anything from where you sit?
I'll go first. I'm not hearing anything in that regard, but we are hearing about the potentially dramatic overextension of the unemployment benefit fund and the need to replenish that fund very quickly after the first of the year. We are expecting, just anecdotally, an increase of 5x on our payments as an employer into that fund going forward. And that affects every business, not just government, but every single business that has an employee is probably going to be paying a lot higher taxes from the unemployment perspective going forward. But I have no information on the administrative difficulties of getting payouts.
I don't have any information, certainly something we can look into, but I've not been made aware of any backlogs. Nobody's complained to me, so I had no reason to look. But they're certainly something we can look into.
Okay. Dr. Spillmann, in-person learning and teaching remains a topic of hot debate. After several months of evaluating the results of schools utilizing the virtual method, is there any, face-to-face, is there any data to support the notion that it's appropriate for schools to still operate in a hybrid or in-person format? At what point should it no longer be considered?
That's a $64 question, isn't it? That's
yes,
no magic answer. There's no magic formula to this. I'll tell you, each school system has its own issues to contend with, and the decision rests with that particular locality to make that decision. We advise about numbers and ways to perhaps to optimize student health for the students to continue to learn. There are issues on pro and con about students being in class versus some other avenue. The basic data supports children being in school to the extent possible. We have seen that the cases are growing. I mean, the whole area is in a surge, so it's not like it's just in the schools. However, the schools are doing quite a good job in both these localities, Pitt and Dan, doing quite a good job at trying to control or manage the risk inside the schools. Does that mean that no children are getting sick or no teachers are getting sick or exposed? No. There is not a magic, again, there's not a magic number, but we see that more things are being brought into the schools than being than being communicated or transmitted within the schools. Some of the concern has to do, frankly, with athletics and students of different schools getting together very close, a lot of forceful use of air, a lot of very close contact, touching. There's most of the sports in high school are very much that way. When children are in school, they're in a probably as clean an environment as they can be in. They're being watched, they're being taught, they're being sheltered, they're being fed, they're otherwise being cared for, and then there's a health care. At least in many of the schools, there is a nurse or equivalent to being there. So we want every opportunity for children to stay in school possible. That said, there have been surges a little bit after Halloween, more after Thanksgiving, and we expect other surges, which contributes to all the other statistics we've talked about and the hospitalization. So my basic thought is, when I get asked, do I have a concern about children being in school? I say absolutely. I absolutely do. I also have a concern about them not being in school. And right now, the way that our localities are handling this favors overall their being in school or a hybrid. I think strict remote does not promote the academics or in many ways the observance or safety that are necessary. Those schools that are going strictly remote still are sending their students to the athletic practices and competitions. Now, up till now, the athletics has been pretty much conditioning, which we all should need, me included. But the direct contact in many of the sports that are the issue. So I think if I don't see that we can close schools without closing other areas that adults tend to congregate. A lot is made of bars or types of things like that, but other types of non-resident congregate settings are really, in my mind, more at risk for spreading this than children being in school. It's also the American Academy of Pediatrics and our data so far bear out that children do weather this storm a bit better. And so that's a long answer to a very short question. Should they be in school? If at all possible, yes. I think aggressive types of quarantining and isolation are important, and everybody following everything that keeps people safely. Again, our superintendents, my hat's off to both of them for doing quite a good job. I do think before we get too far along, the 3 W's are so important. Wear the mask, watch your distance, and wash your hands. Now in school, those things are really, they write herd very well on that. But what we're not always considering is the people who are not doing that out in the general population do ultimately affect its getting into the schools. So this is not just a contained, encapsulated, isolated society, a school. It's part of the whole. And if we want the kids in school, we have to all play our parts. So that's I'll get off my here into the lesson for now.
No, that's well said. Thank you so much. I think it is, and Ken mentioned that earlier too, we all need to do what we can to support and help one another. And I echo your sentiment. And I know each of on this call is grateful to our school superintendents who are just doing tremendously difficult work right now in service to children and families across this region. So thank you to them and to all of our teachers and staffers in the systems. This is a fun one, David and Ken, for the 3 of us, actually. Would the chamber, city, and county work together to do a, quote, shock and awe PR campaign to offset all of the false rumors and get the correct word out? I'm looking at my board chair, Alan Larson. I think he would support the chamber and certainly doing that to protect one another. Ken, David, what are your thoughts on that?
I'm happy to do whatever I need to do to help. I hope people would listen. I'm shock and awe, whatever it takes. Like what Dr. Spillmann said, my wife's a teacher, 100% of the kids and teachers and principals and everybody inside of a school system is practicing the 3 W's. And then, like Alan Larson said, he goes through a grocery store and only 75% are. That's a lot.
I didn't say
That's a
grocery
big
store.
difference.
I said a retail store. I
A
wasn't
retail
going to name
store.
a store, but there was a retail store that did not have everybody wearing a mask.
So if we can, if we had 100% compliance everywhere, then hey, no problem.
I think that's what this event was hoped to be, a little bit, Alexis. And so if we can, we've got roughly 100 people watching either on Facebook or live. If each of you can tell 10 people what you learned today, I think that will go a long ways to help in accomplishing that shock and awe. But we'll come up with some creative ways to be able to. Now, I would say the only potential concern of that is that shock and awe communication now gets people fearful about seeking healthcare when they need to. So I'm having chest pain, I'm having stroke-like symptoms, and I'm so afraid of COVID that I'm not going to seek professional help. I won't call 911. I won't come to the hospital. That's worse. There's a higher chance you will die for not seeking care when you need to because you're afraid of getting exposed to COVID. As Dr. Spillmann said, the hospitals, the schools, that's probably the cleanest place in our community right now. The likelihood of you getting exposed to COVID in the hospital. The employees that I have who have COVID got exposed in the community, not in the hospital.
Thank you, Alan. David, did you want to add to that from the county's perspective?
I'll say we're due. We should be doing something. We did have an aggressive PR campaign early. It's probably time for us to do the masks again. We distributed lots and lots of masks early, and maybe we can do that again, as well as some educational propaganda. I would be very much in favor of that. Accordingly, back to one of Ken's comments, we need to be in contact with our legislators, particularly on the federal level, to clear up this logjam in whatever form it takes. We need the resources to flow, not only for the economy's wherewithal, but also for our sustained effort in supporting our communities for the next 4 to 6 months, it seems.
Thank you for that. Dr. Desai, the next question is about the vaccine. Is it a one-time vaccination or are there multiple doses?
Currently, the vaccine that we have, or that we are going to be getting, is 2 shots, and it has to be done 21 days apart. The first dose on day 0 and 21 days later, the first dose has lesser number of side effects compared to the second dose, where you can have a little bit more pain, fatigue, and tiredness. And that is very common. I mean, whenever you give a vaccine that has a booster dose, which is given in a quick succession for any infection, we do see increased vaccine-related effects with the second dose. So that is not unique to this vaccine. Yeah. And again, I mean, just going about the schools, there was actually a study done by Emily Oster from Harvard. She's an economist at Harvard. And this was an extensive study done using the New York schools and COVID-19 situation in these schools. It's a great read, amazing amount of data available that clearly shows that opening schools K to 6th grade did not show an increase in infection rate. And they actually, as a conclusion of the study, they say K to 6 being open and allowing education to happen in person is risk-free. I mean, I wouldn't say 100% risk-free, but it's safe. It's very safe, and it also stresses the importance of the teachers being surveyed on a weekly aspect or something like that to see if they get the infection. I mean, that they are at a higher risk than the students themselves or the students carrying the infection home. As Dr. Spillmann rightly pointed out, as they grow into the higher grades, secondly, to increase physical contact in sports and by other nature, they seem to be at a higher risk for spreading the infection, but not being affected by the infection. Sorry, I kind of digressed there, but yeah.
No, that's really helpful. So thank you for that. We do have just a couple more, and I know our time is winding down. We have a comment from Ms. Ross. Thank you, Everlina. that for our panelists particularly, but for other members that, community action engages with so many in our community, and they're happy to share and provide information to their clients and distribute that. So I would encourage us, as we're thinking about getting information out. Certainly the chamber is always willing to do that in our localities, but we have wonderful partners like PCCA and the Boys and Girls Club and many others who can do that. So just a quick note there. Thank you, Everlina, for bringing that to our attention. Question for you, Dr. Spillmann. Should local governments consider implementing more restrictions on restaurants, stores, events, instead of waiting for the governor to do so? Would that be a proactive step toward limiting community spread? And I will step right in front of that question. I don't want Dr. Spillmann to get that. I think I'd rather direct that. Start with Ken and David, and Dr. Spillmann, if you want to add to that, you're certainly welcome to do so.
It's my understanding that based on the the fact that we are a Dillon's rural state, that the local government has no authority to supersede the governor's requirements or to make anything more restrictive. So we don't have that tool in our toolbox, unless that's my understanding. David, you may have a different perception of that, but that's my understanding.
No, I see it the same way, and lots of counties in our region are exhibiting signs of bluster around that issue, and I won't deny that conversation certainly exists at Pittsylvania County government also. However, our ability constitutionally to do anything in that regard is highly limited.
I guess it's
Dr.
my
Spillmann,
turn.
before we move on, you're welcome to jump in on this one. Yes.
I'm going to jump in from a slightly different angle than my two municipal colleagues there. I'm going to say that frankly, there are no safe places specifically. I mean, they're only safe behaviors. The hospital and the schools are safe behaviors. And the activities related to other businesses are only as safe as the behaviors of the people who were there. And so that is where, if I were going to really, I'm not sure how well, there's already been a city legislation in support of masking, yet there's what I would consider at this stage a gap in compliance. And so if I were going to say anything else, please, the 3 W's are so, it's not like we're in World War II and we don't have certain things to eat. It's just for a few more, well, several more months. Even with the vaccine, we're going to have to continue to do this for a while till we really demonstrate that we're having the effect we want. But just, do I think that, I did mention about establishments. I don't think we need to close. I think we need to, we need to make sure, it's an example that we really need to make sure that we're really, everybody is following those W's. Over.
Thank you for that. We are about out of time, so I want to take a moment to thank each of you for being with us on the call today for this information. We will share the recording with you afterwards, and feel free to share it far and wide. Alan, Ken, David, Dr. Desai, Dr. Spillmann, just an incredibly important program. And we're so grateful for your time today, but for your continued leadership throughout this crisis in our region. Certainly also for those on the call, questions, concerns, you want to get in touch with one of our speakers, please reach out to Rachel or me, and we'd be happy to make that happen for you. And so with that, thanks again to each of you, wishing everyone a safe and healthy week and weekend.
Get your flu shot.